All right, you're live.
Hey guys, it's Dr. Emer. We're in West Hollywood and we are doing a staff treatment night. It's always fun to do these because everyone on Instagram and Facebook loves to follow our staff and see how beautiful they're always looking and what they're doing for maintenance treatment. So we have John today, who is his lips. No, I'm kidding. Never necessary, but always good for hydration and kind of just subtle softening of the lip. Look at his lips already; they're perfect. But what we're gonna do is do a little upturn in right at the cupid's bow and just a little extension of the lower lip to just give it that extra little pizzazz. Okay, so we're gonna do a little injection. And what I'm gonna do for him is we're gonna stay a little bit more anterior and do little microaliquot injections with threading, and that's gonna allow us to extend the lip slightly, but keep it a nice subtle plump. Remember that the bottom lip should always be a little bit bigger than the upper lip. We're doing subtle softening, and look at what we're using. Juvéderm Volbella. We love this because it's very soft and it gives a subtle look, and it lasts typically up to a year. And the issue we had with John, and this is very, very common in LA, is many of the people really exercise a lot. And the problem with that is they burn off the filler. This filler seems to last very well in our younger males who exercise a lot, because John's ripped. And how is Volbella lasting for you? Excellent. We love it. Mm-hmm. Once I inject, I'll have John tell you why he loves it. But we're going to extend out the lip just a little bit because his face does very well with a little wider. And with Volbella, you can get a really softened look quite easily. And it doesn't look like anything's done. It's one of our favorite go-to injectables for the lip and around the mouth. Let's take a look from the front. Oh, perfect. Gotta give him that lower lip pout. Microaliquot injections just to extend the lip itself, and a little bit into the cupid's bow. Perfect.
Great.
Let's do just a light little massage. And now let's show him. Grab that mirror over there.
More reaction time.
Because he's going out tonight.
Woo! That looks amazing.
So because you're very educated with the Juvéderm family of
Yeah.
products. Why do you like Volbella and where do you like it?
So definitely for lips, it's one of our favorite go-tos. A big selling point originally was that it came in a half syringe and how soft it is. Now that we have it in a full syringe, that's even better for some other areas. But it's so soft. It's one of those things where even though we joke around, it's super kissable, as we say, and feels very good and natural in the lip because you don't feel it. And it works for any patient, and we've never had anybody upset with Volbella because again, it's just so reliable and it's fantastic. Really good.
And so Juvéderm and Restylane are very well-known products, but you feel them a little bit more. Now Juvéderm is a homogeneous gel, so you don't feel it as much. It's very soft, whereas Restylane looks like Dippin' Dots under a microscope as little beads. So you sometimes feel a little bit more of a rubbery feel, but the newer Vycross technology fillers, Voluma, Volbella, and Velour, are much softer and they last much longer. So that's what John was talking about when he has the kissable lip, because I tell people if you want to kiss, you better use Vycross because it's soft and you won't feel it. So the next part we're going to do real quick is just our traditional crow's feet treatment. We're going to use a little Botox around the eyes to soften that look, so smile as big as you can. He doesn't have much lines because we have Botox there already, but one of the things we can do is we just do a subtle kind of touch up to the muscles around the eye. And then I want to show everyone something. Smile again. You see how he's a little extension as we move down? You can go, the orbicularis muscle actually does extend a little bit. So you can kind of go out and just do these micro droplets all throughout. And it'll just soften everything. Nothing crazy, just a few units here or there. Smile as big as you can. Doesn't have as much movement there right now because we already have done treatment. But we're just going to soften it by putting these little subdermal blebs
Someone said, is this the same fillers that is used for the underarms to reduce the sweaty armpits?
This is the same Botox, yes. And we showed a video of that recently, and you could use that to just stop the nerves that stimulate the sweat glands. Smile as big as you can again. Relax.
Have you had any issues with nodule formation using Volbella?
Well, that's a good question because a lot of people get nervous about Vicross technology fillers because they're longer lasting, so people have reported lumps and bumps or inflammatory nodules. In our hands, we've actually never had that, ever.
Yeah.
With that said, the larger the volume you do of that with any filler, the larger the chance of inflammation. So it's better to do small amounts over time, especially when you do sensitive areas like the under eyes or the lips. We like to take it slow because if you do it that way, then the chance of having those side effects are limited. So that's really it. Smile as big as you can. You see we follow where his movement is. Those little blebs will go down before he gets to dinner and he's ready to go. So take care from West Hollywood. Dr. Emer, bye.
Boom.
Great.